things first. Of course, we ask client or patient what's bother most, meaning is it any headaches, is it any additional comments to the general conditions, what we know previously from the physicians who refer them to us, or we just always can see the intake form. We can definitely see the tension and feel the tightness around the neck, as most of the people have that. Plus, of course, we definitely stretch the head box, of course, and definitely we can see that tension around as well. So after we perform massage, we are looking for stretches which separate shoulder from the neck. Simple, light pressure to the shoulder with the holding of the neck and little push, which brings more muscle to release, like that. After we turn to another side, this motion we release the tension from trapezius down to the clavicular joint and the shoulder head, and down to the arms and hands. But the most attention we have to pay, of course, to the neck, as the neck is the most significant place which holds the tension. So what we're doing here with the light pressure, we pull it up. Of course, we can ask patient or client how does they feel during that. If they feel not enough, we can switch to the deeper rotations like that, and of course we can turn the head a little bit and use our thumb, just like that. After when we did those manipulations, of course we can also move the hand a little bit to open up the trapezius even more, so that stretch goes that way, and it's gonna cause us to release the tension from the vertebra on the upper body. So with light pressure in the middle, you can definitely lift up the calf and rotator cuff muscles, check them up if there any problems in there, right here on the side and right here on top. With the light grip, you can pull it a little bit, and we definitely can feel the tension from the front, which we're going to do next. That's how it goes with the arms and neck. Then we go a little bit down, touching the vertebra where the tension is, and we can push lightly to the sides, all the way down to the glutes. While we're doing that, we have to pay attention on the leg, how easy and frequently it moves. So what it's going to tell us is that any tension exists in the hamstring and lower extremities in general. As we can see, the leg is waving with light pressure, so that means it's not much tension going on in there. So we can switch to another side. Also light push, light pressure, glutes, sacrum, 1, 2, 3. Always remember to count yours in your mind. With not that deep push, be pressing down to the pelvic area and releasing the sacrum in general. We can continue that on the sides, like this, and then we can go down by the hamstrings and calves. Very important to ask the client if they have any injuries on the knee, as we're going to rotate them and we're going to move the hip joint and check it up what kind of tension going on exactly in the socket of the hip joint. Okay, so light push again and again, and we can ask the patient to drop the leg and just stretch it down as it is, but remember about the knee. It should be on the table, not out, and it should be done very, very light, like this. Hands up. This hand go up, that goes down, like this. Alright, so we down here on the hip area and lower back exactly. So with a turn right or left, we can definitely see what tension going on in the in the lower back area, which is lumbar spine. Definitely we can see the tension on the lower back here, and we can figure it out what kind of stretch the patient or client needs. As well, we can always pick it up a little bit and definitely check it up the front part, which we're gonna come back in a moment, and we can see the tension on the lower back in general. Same thing going on the other side. Let's just do a quick intro as well. Just to the side, a little push, rotation. Always remember about the knee. Little lift, 1, 2, 3, push, and the other way, just like this. Of course, we can stretch again. It's always good to do a few times the same thing what you just did before. As well, we can cross the legs this way. Remember each side, 1, another side, 2, and the most interesting one goes that way. By doing this, we definitely can see what's going on in the pelvic area, in the sacrum here, and the hamstrings, and the quads as well, because as deeper we press on the legs there, the more pressure we create in the bottom. 1, 2, 3. And general stretch, which goes this way. As long as we have the one side pulled, you can always press lightly. One side, there, and another one, like this. One, two, and for the legs and lower back stretches, we will do the general hamstring stretch, which is going to cause our lower back to release the tension as well. Always remember to stabilize the knee and ask your client what they feel during the stretch. Always ask them to pull the toes down by themselves first before you're going to press them, because you never know what's going on the Achilles, which is always tense as well. So please pull your toes down. Go ahead. Pull it, and you just simply push the leg toward your client. By that action, you can definitely see the stretch of the hamstring, you can see the hips, and you can always apply more pressure by yourself like this. But remember always to stabilize the knee. That's the key of this stretch. And push it down a little bit by the toes, just like this. 1, 2, and 3. We're gonna repeat it on that side. And same thing. You ask your client, patient, to pull your toes, stabilize the knee, and push. And 1, and 2, and 3. We can do always both legs. This stretch requires us to ask client to release and relax the legs, abdominal, and the toes. The key of this stretch is find the perfect angle right there, so it's not too strong and it's not too light, so they definitely feel the lower back. Always remember to talk to your client what they feel and how they feel. If they want more, we can definitely press harder or less. Also, we can perform that in this way. 1, 2, 3. Again, the most important part here is the knee. If they have any injuries of the knee, you have to be very careful. 1, 2, and 3. As we finish the legs, we can always move up again to the neck and just generally stretch it from the front side. Always remember to pull up a little bit the chin, or you can ask your client how comfortable they feel it. Pick it up the hand, your hand like this, head this way. That helps us to release the shoulder, sternum as well. Extremely important for the people who sit in front of the computer, books, and all electronic devices during the day. So we definitely see the tension as we move the hands down and try to pick it up, just like this. Pick it up. Then we can always move it and start to palpate and massage those muscles and add a little extra pressure right there, and you just pick it up. A little action like this around the ears, and you can ask your client, simply drop your head. There we go. That helps them to release the tension from the neck, as well as like emotional calm down in general. So we pull it up a little bit. 1, 2, 3. Also we can do this way. 1, 2, and 3. Other side. 1, 2, and 3. And as the end up of the session, I always ask client to take a deep breath, and I always do a few seconds, or depends if the clients require, I'd ask TMJ. Those joints are definitely related to the neck, and neck is related to those joints as well, because the posture and the neck and all the stress always here on your head, right around the temples, right around your eyes. And remember, eyes is the one of the hardest working organs, even they're moving even faster than your heart. So remember to clean up the tension from this area. Definitely release your headaches. Definitely helps in insomnia cases. Sometimes it even get rid of them. And the neck in general, right there.